When many of us think about the pandemic, we often associate it with physical ailments. But it's not just our medical health that's been impacted. For many of us, the worry, stress, and separation from the people we love and the places we gather took a toll on our mental health as well. From teens to older adults, many people experience and continue to experience symptoms of fear, anxiety, or depression, some for the very first time and without even realizing what's happening. Whether it's you or someone you love, understanding the signs and symptoms is important. In our three-part mini podcast series, Lessons Learned from the Pandemic, we've invited Stanford's leaders and top healthcare professionals to share their insights on topics ranging from the community's response to primary care and prevention, as well as mental health. In today's episode, we'll be exploring the topic of mental health.
Joining us for the third and final episode of our three-part series is Carolina Grijalba-Rodriguez, who has been at the forefront of mental health in the city of Stamford. Carolina is a licensed clinical social worker for the City of Stamford Police Department Behavioral Health Unit. She works with the city's police officers to respond to mental health calls. She's here today to discuss the importance of mental health wellness. Welcome, Carolina.
Hi, thank you for having me.
We are excited that you're here.
Yes.
And so am I. I was looking forward to this conversation.
In our first episode, we had the opportunity to talk with Mayor Caroline Simmons and Acting Director of Health Jody Bishop Pullen about the community's response. And in episode 2, we spoke to Dr. Yoon about primary care and prevention. Equally as important is COVID's impact on our mental health and mental health wellness. Over the past 2+ years, we've heard that anxiety and mental health conditions have been on the rise. Carolina, why is mental health such an important topic?
When we talk about mental health, is how we take on the world, how we view the world, how we feel, how we interact with others, how we encounter day-to-day basis. So for the past 2 years, during our COVID time, we've had to endure solitude, where we had to stay away from our loved ones, our friends, our schools, our work. And that has definitely changed the way we've interacted. One of the basic needs that we have as humans is connection. And unfortunately, COVID impacted our ability to connect and socialize the way that we've normally done over the years. While many of these changes may be still necessary to limit the spread of COVID, they lead to less human interaction. As the weather warms up here in the Northeast, outdoor activities and gatherings will be back on the table, and I'm personally looking forward to that.
Yeah.
So, even though we're still finding our way through the pandemic, we'll have some more ways to safely connect with one another in person for the next 6 months or so.
That's fascinating. So, I have a two-part question. For those of us wanting to better understand our own mental health, first, can you please explain what the difference is between anxiety and typical daily stress?
The main difference between anxiety and other mental health is how it impacts your ability to function. So, for example,
Mm.
if I wake up worried about a test that I'm about to take, right? You get those butterflies in your stomach, you feel a little bit worried about it. You go take the test, and all those feelings go away. There's a sign of
Right.
relief. Okay, took the test, now I got to wait for the results, and that's the end of it. When we talk about anxiety, it's a cluster of symptoms that people experience over a period of time that impacts their ability to function on a daily basis.
Oh.
So when we think about anxieties, let's say I'm anxious because of COVID, right? Do I wear a mask? Do I not wear a mask? Do I clean my hands? Are people cleaning their hands as often as they were at the beginning of the pandemic? It prevents them from being able to go to the grocery store, go to school, to work, because they're concerned about what is happening around their surroundings.
Okay. What other mental health related conditions might people be experiencing?
I think one of the most prevalent that we oftentimes hear is depression. And a lot of people will say to you, well, I feel depressed. Okay. But what makes it a mental health concern is when this is once again impacting your ability to function. basically. It's impacting your ability to interact with others, how you view yourself, how you view others. When we actually talk about depression, it's not something that is a 24-hour thing. It goes on for weeks on end. And for some people, it could be brief. For some people, it can take longer.
Can you tell us what are the signs people should look for to indicate that they could benefit from talking to a professional?
Hey, you know what? Maybe I should talk to somebody. As soon as that question comes up on your mind, it's a good rule of thumb to say it's time to call somebody. So we have to be on the lookout for signs like you have difficulty concentrating, you have this increased worry that impacts your ability to function on a daily basis. You're having digestive issues. You might stop wanting to eat, you might want to overeat, you might suffer from stomach aches, you have trouble sleeping, you have trouble being able to do things that you enjoy. If you
Mhm.
kind of like withdraw yourself from being able to do those things that bring you joy and happiness, those are main indicators of, this is time for me to make a phone call, get some help. Understand that we are not alone in this issue. Mental health affects 1 in 5 adults and 1 in 6 youth on a yearly basis. So if you have that question, if that question pops up to your mind to say, you know what, should I seek out help? The answer is yes, you should. So the first step should be your primary care doctor to say, hey, you know what? I've been struggling with this inability to concentrate. I've been having all this digestive issues. I'm having anxiety in the morning, anxiety in the afternoon, anxiety at night that is really impacting my daily life. Now, in Stanford, we have many, many resources, but you can definitely come to the City of Stanford's website, which is at stanfordct.gov, and that's connected to all the local resources. In addition, if you're experiencing a crisis at the moment where you feel like, you know what, I've tried it all, I feel trapped, I can't get any help, or there's nowhere I can go. If it's an emergency, calling 911 is definitely a priority. If you feel like you want to just talk to someone or you want to be connected with a therapist and you don't have a primary care doctor, 211 is another option. 911, 211, those are options that are open to everybody 24/7. And lastly, another resource that we have is the Connect to 741-741, which is a way for you to send a text and be connected with a trained counselor.
Thank you so much for giving us those resources.
Wow, that's good to know. In closing, what are some things we can all do to maintain our own mental health wellness?
Self-care.
Mhm.
And people think of self-care as I'm going to go out shopping, I'm going to go for a walk,
Take a
right?
bubble
Or
bath.
exactly, right? I used to think of self care in that matter, right? I used to think
Mhm,
of it as a once a week type of thing or once a month type of thing.
mhm,
But what I've learned over the years is that self care is something that it becomes a way of life in how you take on your daily practices. From the
mm,
moment you open up your eyes, how are you taking care of yourself? And just implementing little things throughout the day, such as making sure you have lunch, making sure you have enough water during the day. I highly recommend before walking into your house, take a moment to have that debriefing moment with yourself.
mm,
Could be finish listening to a song, it could be clearing your thoughts before you walk into your home. And one thing that I also think is important is for us to be able to set boundaries.
mm.
If we don't feel comfortable going out or doing something, not feeling that pressure to do things you don't want to do, to be able to give yourself the space and to be able to say no. That's part of how we take care of ourselves. Other things you can look into is having a routine in regards to exercise, being able to have things that bring you joy and happiness. It's important to feed our soul,
Mm.
right? It's important for us to develop daily practices, making it about this is what I do to nurture myself.
Well, this has been an inspiring way to close out our three-part series on lessons learned from the pandemic. Thank you, Carolina, for joining us today to discuss mental health and helping us and our community understand the importance of taking care of ourselves, not just physically, but especially mentally. And friends, if you haven't listened to episode 1 about the Stamford community's response with Stamford Mayor Caroline Simmons and Acting Health Director Jody Bishop-Pullen, or episode 2 about primary care and prevention with Dr. Henry Yoon, we invite you to take a listen to these timely and informative episodes. We hope you've enjoyed listening to our series and found the topics discussed helpful. You can find more information on the city's website at stamfordct.gov.